K. Divya, registered international yoga teacher, Yoga Alliance, USA. Student of IIT Yoga Therapy. Experience in yoga 2 years.
K. Divya, Health Warriors of Yoga Therapy. We are proud of your yogic services.
Good afternoon to everyone. Thank you, ma'am and sir, for giving this opportunity. Today, my topic is therapeutical application of yoga for osteoarthritis. First, what is arthritis? Arthritis is the swelling and tenderness of one or more joints. The word arthritis is derived from the Greek word ortho and itis, which means joint and inflammation. There are five common types of arthritis. First one is osteoarthritis and rheumatoid arthritis, psoriatic arthritis, and fibromyalgia and gouty arthritis. Rheumatoid arthritis was an autoimmune disease. Psoriatic arthritis was typically seen in people who have psoriasis, an autoimmune skin condition. Fibromyalgia was mucoskeletal pain. People those who have rheumatoid also have fibromyalgia. Gouty arthritis has a very specific cause, deposits of which uric acid crystals in a joint. Osteoarthritis is the most common form of the arthritis, it affecting millions of people worldwide. It occurs when the protective cartilage that cushions ends of the bones wears down over time. Although it can damage any joint of hands and knees and hip and spine. Cartilage. What is cartilage? Cartilage is a protein substance that serves as a cushion between the bones of the joints. This cartilage wears down completely. Bone will drop on other bone. Symptoms of the osteoarthritis are pain, mild swelling, reduced flexibility, clicking and cracking sounds, and bone spurs, stiffness. Risk factors of osteoarthritis is older age, obesity, genetics, metabolic diseases, repeated stress on the joint, injuries, and gender. Now, how yoga helps to cure this? Yoga therapy has shown significant reduction in pain, functional disability with improved strength, balance, and gait. When used as an adjunct in the management of rheumatoid arthritis, hand arthritis, and osteoarthritis knee, although we know that the psychological components such as depression and anxiety are important aspects to be addressed in pain management, and yoga has shown its contributory role. There are no yoga studies that have looked at the relationship between anxiety and pain in clients with osteoarthritis knees. Scientific studies. Osteoarthritis is a chronic and incapacitating condition. This is the second common complaint of the outpatients and incapacitates about 10% of the whole human population with chronic pain and inflammation. Knee is the most common joint involved with primary osteoarthritis. Knee osteoarthritis mainly occurs in elders and middle-aged people and is more common among women and overweight subjects. The condition's progress is slow and joints are rather involved bilaterally and symmetrically. The symptoms include pain, stiffness, and decreased range of motion, which result in limited activity and reduced quality of life. The main goal of rehabilitation in such clients is reducing pain, restoring function, and improving patients' quality of life. Ebenezer studied the effects of yoga exercise on pain, morning stiffness, and anxiety of 250 patients with new osteoarthritis. The control group only received physical therapy, but the experimental group received physical therapy and yoga. Researchers concluded that doing yoga and physical therapy together has more positive effects than physical therapy alone. The results showed greater decrease in pain, morning stiffness, and anxiety in the patients of the experimental group. Aim: to examine the effect of integrated yoga on pain, morning stiffness, and anxiety in osteoarthritis of knees. Reason: osteoarthritis occurs when the cartilage that cushions ends of the bones in your joints gradually deteriorates. Cartilage is a firm, slippery tissue that enables nearly frictionless joint motion. Eventually, if the cartilage wears down completely, the bone will rub. Osteoarthritis has often been referred to as a wear and tear disease, but besides the breakdown of cartilage, osteoarthritis affects the entire joint. It causes changes in the bone and deterioration of the connective tissues that hold the joint together and attach muscle to bone. It also causes inflammation and joint lining. Evaluation: during the physical exam, check the affected joint for tenderness, swelling, redness, and flexibility. X-rays cartilage doesn't show up on X-ray images, but cartilage loss is revealed by a narrowing of the space between the bones in your joint. An X-ray can also show bone spurs around a joint. Magnetic resonance of imaging, அதாவது MRI. An MRI uses radio waves and a strong magnetic field to produce detailed images of bone and soft tissues, including cartilage. An MRI isn't commonly needed to diagnose osteoarthritis, but can help provide more information in complex cases. Joint fluid analysis: get fluid from an affected joint. The fluid is then tested for inflammation and to determine whether pain is caused by gout or an infection rather than osteoarthritis. Structuring the therapy. The Yoga for Osteoarthritis intervention program was initially designed by the lead yoga instructor based on focused literature review on relevant yoga program. The draft program was reviewed by an expert who specialized in teaching individuals. The final program was approved by all the experts and implemented in the study. The yoga sessions were held 3 times in a week for 8 weeks for each 60-minute session. Methods. The study randomized controlled trial design with 2 arms. One is yoga group and a control group. The yoga group had 60 minutes yoga sessions 3 times a week and for 8 weeks. Sessions were run by a yoga professional trainer and supervised by a physical therapist. The control group was only doing their ordinary daily activities. Every exercise session consisted of 3 parts. First is 15 minutes warm-up exercise, main exercise, and 15 minutes cool down exercise. During the period, according to each patient's abilities, the principle of overload was applied as increase in repeats or time of holding a move or more advanced exercise. Pain, symptoms, daily activities, and quality of life were respectively measured. Themes governing the yoga therapy. Affirmation. Affirmation gives mind strength to the clients. Next, Shukshma Vyama for the loosening exercise, and specified asanas, asanas with props, mindfulness meditation, pranayamas, mudras, and mantras. Asanas: Pada Hastasana, Bhujangasana, Balasana, Ardha Katti Chakrasana, Baddha Konasana, Ardha Machendrasana, Veerabhadrasana, Trikonasana, Adho Mukha Svanasana. These asanas helps in reduce joint pain, improve joint flexibility and function, and lower stress and tension to promote better sleep. Meditation. Mindfulness based stress reduction is the one of the effective form of meditation. This meditation technique is about being fully present in the moment and acknowledging thoughts, feelings and sensations in an open, non-judgmental way. For example, if you feel a painful sensation in your knee, instead of negatively labeling it, you simply acknowledge it, accept it, and let it go. This helps you break the pattern of negative thinking, which can make pain worse. Summary. Adjunctive program of integrated approach of yoga therapy for ortho OA. OA knees reduces rest pain, early morning stiffness, anxiety, and blood pressure and pulse rate. Yoga offers a good value addition as a non-pharmacological intervention in a management of OA knees. In summary, the previous evidence and present studies suggest that yoga is an acceptable and safe intervention which may result in clinically relevant improvements in pain and functional outcome associated with a range of musculoskeletal conditions such as osteoarthritis. The present study would suggest that yoga was useful in decreasing pain and increasing functional mobility in this study over time.